Okay, good morning everyone. I will be performing the application of hot compress. Okay, first thing first, I'll be identifying the patient.
I'm Michael Tiago, your student. Here's my name.
Jerby Quintareso,
Age.
19 years old,
Date of birth.
February 13, 2007.
After identifying the patient, I'll identify the order of the type of voice, heat, application, location, duration, and desired temperature. Then after that, I'll review the chart of the patient and medical history and contraindication that may prohibit hot temperature. And then I will assist the patient's skin around the area. We'll check the temperature, pain, and sensitivity of the patient. And after that, if there are wounds, we will checking on the size, color, tenderness, and drainage. And then I will inform the significant others. Let's just assume that I already done that. And then we will be proceeding on the next procedure, which is taking the vital signs of the patient. And then I identify the patient outcomes. And then let's just assume that I already done that, the vital sign. And then next, I'll prepare the equipment which is already at the side of the bed. We have alcohol, gloves, hot compress, and some extra towels on the side. And then next, I'll be explaining the procedure on the patient. Okay, ma'am, I'll be doing a hot compress on your skin, and let me know if you feel any pain. And then after that, I'll provide privacy for the patients by closing the curtains. And after that, I'll adjust the bed for a comfortable and working position. And then next, I'll drape the patient by exposing his arms. And then after that, I'll perform hand hygiene. I'll put on alcohol and wear my gloves and prevent microorganisms. And then after that, I'll put a waterproof pad underneath the patient's arm. After putting that, I'll hot compress the patient's skin for 60 seconds by tapping it on his arms. And after that, let's just assume that I already finished it. We will stop immediately if there are any problem, and we will inspect the skin of the patient where we hot compress the patient arms. And while inspecting, we will ask the patient if he feel any discomfort while doing that. And then after that, we will take the vital sign again of the patient, and let's just assume that I already done that. Then after that, we will remove the pad of the underneath the patient's arm. After removing that, let's just put it on a comfortable position, and we will perform hand hygiene and remove our gloves and perform hand hygiene again and document the findings after that. Okay, next we will be performing the application of cold compress. And first, I'll identify the patient. Good morning, ma'am. I'm Michael Tiago, your student nurse for today. Good morning, ma'am. I'm Michael Tiago, your student nurse. May I know your name, age, and date of birth?
December 31, 2006.
After that, we'll verify the order of the moist cold application, location, duration, and temperature. And review the patient's chart for any physical activity. And then I'll assess the skin of the patient by checking his arm. After inspecting the patient's skin, I'll inspect wound, if any size, color or odor, tenderness, and drainage for the family awareness, understanding, and safety factors. And after that, Let's just assume that I already checked the patient's vital sign and mobility. Now identify the expected outcomes and ready the equipment which is already at the side of the bed. And after that, explain the procedure for the patient, which is applying cold compress for the skin and close the curtains for the privacy of the patient. And position the bed of the patient on a comfortable and working position. And after that, we'll perform hand hygiene and put on gloves after hand hygiene. And then after that, we will get a waterproof pad and put it under the patient's arm. I'll submerge or cold compress the patient's arm and then remove excess moist for the patient's arm, and then apply it for 15 to 20 minutes, and then we will rinse it again. We'll reapply it to the patient's arm. Then after this, we will check the condition of the skin of the patient in regular interval and stuff if there are complication occur. Then after that, we will remove the water pad underneath the patient's arm, and then we will put the patient on a comfortable position. Then after that, we will remove our gloves and perform hand hygiene. And then we will document the findings of the patient's skin.